You are listening to The Scope, Phelps Health Podcast, Episode 19. Today we're talking about Epic, Phelps Health's new electronic record system. Let's get started. Hi everybody, I'm your host, Paige Hyten. The Scope Podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or subscribe to our YouTube channel. You can also find us on Facebook, Twitter, Instagram, and LinkedIn. All links are also in the show notes. Now let's get into our show. Today we have a super exciting guest, Lacie Shultz, who is the Epic Program Director at Phelps Health. Welcome to our show today.
Thank you. I'm glad to be here.
We're super excited to have you, mostly because I love your mask so much. You have the coolest mask I think I've ever seen. So, Lacie, before we dive into kind of what Epic is, tell us a little bit about your background.
Yeah, sure. So I've been with Phelps Health for over 7 years.
Mm-hmm.
I've been in healthcare for over 15 and actually joined this project during the selection phase. So when we were selecting our new electronic health record system. And I knew then that once Epic was chosen, I really wanted to be involved in the project in a much bigger way. So it was such an honor to be chosen as the Epic Program Director. And I work with some really amazing and talented individuals. And I continue to be impressed with the forward thinking and the embracing of technology with our leadership team. And, you know, we have from our comprehensive Delverde Cancer Institute to our Da Vinci robotic surgery, and now we're implementing Epic, you know, the most comprehensive electronic health record system used by top healthcare organizations in the nation. So it's really exciting to have these innovative tools right here in Rolla to better serve our patients.
Absolutely. I think you nailed it. One thing Phelps Health is really good at is innovating and moving forward into the future. And COVID-19 has really kind of pushed us into the future, and I think it's something that we were well prepared for. So diving into what Epic is, which is an electronic health record system, it was selected after, considerable discussions with staff and leadership, as well as visits to the company headquarters in Verona, Wisconsin. So this was a really long process to decide how we were going to choose this new system and what we were going to do. So what was the reason behind Phelps Health choosing Epic?
So currently we are on several different systems. So as a patient, when you are seen at the hospital, it's a different medical record system versus whenever you see your provider in the clinic.
Okay.
And from a clinician point of view, it's very cumbersome to have to look in multiple places to find all of the information on one patient. So choosing Epic, the driving factor was having that one true medical record for our patients.
Because not only, like you said, does it make it easier for the physicians and the providers on the back end, but because it's easier for them, it makes the patient experience so much more seamless, right?
Yes, exactly. And, it leads to better patient care, coordination of care, because now you can see everything in one place. And also with Epic, we also get to share patient information across other organizations that use Epic as well. So whenever patients are seeking care beyond Phelps Health, we can share that information easily.
That's fantastic. Right now, we're kind of on two different systems, and they don't work well together. And I know you just kind of talked about this a little bit, but what exactly will Epic change about that? And is that a hard process to move? How long have you guys been working on this?
Right, so whenever our patients are seen, whether they're being seen at the hospital or in the medical group by their provider or even receiving home care treatment, it will be the same system that all of our clinicians will access so they can share that information easily.
Regardless of where they're at. So let's say that I'm like in Salem and then I have to come to like the main campus hospital for something. That's going to be the same record regardless of where I'm at. I'm not going to have to make like 4 or 5 different phone calls.
Right, exactly. So across all of Phelps Health, it will be the same patient record.
That's fantastic. I think that's what people want to hear too, because whenever you think about primary care or providers or where you even start within the hospital system, it sometimes does feel very, very cumbersome, not just for the providers, but especially for the patients. And then I think about myself and my husband, and we don't even have kids yet.
Right.
And sometimes it's hard for us.
Yeah, absolutely.
So how will a patient's care become more seamless and be integrated with other health systems? Because there are health systems outside of Phelps Health.
Absolutely. So one of the great benefits of being an Epic community member is that you get to share patient information seamlessly, electronically with each other. So when a patient seeks care at another healthcare organization that also has Epic, their information will be shared both ways. So we would share our information about that patient, but we'll also get to receive that information back. So that means less work for the patient having to make sure that their records were sent, and then our clinicians can easily see that at any given time.
So not only can patients get their information shared with like these Epic communities, but can they also get their information shared maybe if they're not part of an Epic community, like the hospital system that they're going to?
Absolutely, yes. So even if the organization is not an Epic organization, there are other ways that information can be shared electronically. And a patient always has the opportunity to share their information if they would choose to through MyChart. So that's a great functionality called Share Everywhere. And the patient can choose to share their information with any healthcare provider they choose.
So if they decide to share that information with Share Everywhere, is that like a one-time thing and then that provider always has access?
So the way that it's set up is that it is a one-time access thing. So a patient would share that and then that access would expire after a certain amount of time.
Yeah, I think that I personally would like that because
Yes.
it would be great for one appointment, but what
Right.
if you move? What if you decide to go to a different provider? What if you had a bad experience? You know what I mean?
Yes, exactly.
There are a lot of different things that could go into that. So when is the official go live date for Epic?
Yeah, so October 1st. It has been a long year that we've been working towards that date, and it's very exciting that it's very close.
So are there any plans to reduce scheduling whenever that go live date hits for patients? Or
Yeah.
what does that go live look like?
Sure, so it is very important that we continue to provide the best patient care that we can. So our providers and staff are going through training right now as we speak. And so they're training and they're practicing in playground environments so that they can be prepared at go live. Now with learning new things, of course,
There's always a learning curve.
there's always a learning curve and things might take a little bit longer the first few times that you do it, but we're doing everything that we can to prepare our providers and staff to be ready.
And what's really great, and this is kind of a silver lining with COVID, we've already prepared our patients to have patience with us.
Yes.
And to kind of be accommodating to what the new normal is whenever they come into a healthcare system. So that's going to, I think, be an easier transition moving into Epic.
Right.
Because they'll already know, hey, this may take a little longer. It may look different this time. I know myself, whenever I go and do my annual wellness exam, I'm electing to do it after go live so that whenever I come in, I can sign up for MyChart because I'm so excited about it.
Yep.
So how will the new system benefit patients specifically? We know it's going to be really great for providers, but if I'm just a Joe Schmo or a Mary Jane coming in, why do I care?
Right. So I think kind of what we've talked about with having, being able to share your information with other, either Epic community members or other organizations that a patient might be seeking care. But MyChart is going to be probably the biggest impact to our patients, and MyChart being the patient portal. So it's an easy, convenient way that they can access their medical records, schedule appointments, pay their bills. There are so many different things that patients can do through MyChart. And it's such a great way to get patients really engaged in their healthcare and become this collaboration with their healthcare team.
You said something that I think is really cool. You said engaged in healthcare. And this is going to be your personal opinion, but why do you think it's so important to be so engaged in healthcare?
Well, so, I mean, there are studies that patients that are engaged in their healthcare have better outcomes. So when you play an active role in taking care of your health and your families, your outcomes will improve. So I think it's important for everyone to really take an active role in their health and to do well.
Absolutely. I completely agree with that. So, I mean, to each his own, but I think that's fantastic. How will the new electronic health system kind of help empower patients to take charge of their health? So something that MyChart will have the capability, the access to, is something called a proxy account. What is a proxy account?
Right, so proxy account would be you are designated to be a proxy for someone else that you are you care about or you play a major role in their health care. So typically you see a parent being a proxy for a child. So it's really having access to that person or that child's information so that you can help them seek the care that they need.
And help them make recommendations or better decisions based on their own lifestyle, which is really cool. So how will Epic consolidate all of the patient's records or information to make it easier whenever patients navigate the health system? Because, like, we have a 6-county region that we support. Yeah. That's kind of big, right? So, for example, they might have like a clinic visit that turns into medical imaging for x-rays, lab work, and then maybe even a referral to a specialist. That's a lot of stuff.
Absolutely. So the great thing about Epic is that it's all going to be consolidated. Now, each time you move into a different place of care setting, so if you are seen in the medical group by your provider for your visit, and then you need to go to the laboratory to get labs drawn. So your information follows you. So there's no more duplication. Now you'll have to check in, of course, at each different transition, but it's not a repetitive thing
filling
that
out
you
the
do
same
today.
paperwork every time.
Right.
What a breath of fresh air.
Yes. Now there may be different different paperwork things for each of the different settings that need to be completed, but your photo ID, your insurance information, your demographic information, all of that follows you.
So speaking of, what should somebody bring to their next appointment once Epic and MyChart go live? Because we're going to have a little bit of a transition with that, right?
Yes, exactly. So as with everyone coming to an appointment now, you need to bring the same information that you do today. So photo ID, your insurance card. It's always great to have a list of your medications and allergies so your clinicians can verify those. So we'll definitely want you to bring everything that you typically do today, bring that with you on your appointment after go live.
Awesome. Yeah, I know. I'm like making a list as you're saying this, like, okay, I need this, I need this. What are some other tips, you know, for how somebody can be prepared when the new electronic health record system goes into effect? Because a lot of people may be very wary, like, what is this new system? Do I need to switch providers? What are some things, like general things that maybe they should just know?
I think just knowing that, you know, this transition is really good for them. This is really going to be a positive impact to them, their care, and the clinical team providing care for them to help really stretch across Phelps Health and really giving them that improved quality of care.
Absolutely. So we're kind of nearing the end of our show, but again, I want to give you an opportunity to kind of share any final thoughts or considerations that you might have with our listeners regarding Epic and all the super cool, exciting things that they can look forward to here in like almost less than a month.
Right. I think we need a lot more time to go over all of the cool functionality of Epic. But as an employee, as a Phelps Health team member, I am very, very excited about what Epic means to our organization and to our team members. But as a patient, as a parent, I am very excited about MyChart. I've tried to get signed up before 10/1, but they just won't let me. But
you have to wait like everyone else.
I know. So MyChart is going to be such a huge impact to our patients and really help have that collaboration with your care team.
Fantastic. So if you're looking forward to Epic and MyChart, make sure you stay tuned for the things that are coming at Phelps Health. If you liked our show and want to know more, check out phelpshealth.org. Thanks so much.